Good day to all, and thank you for joining the National Mass Violence Center's 11th National Town Hall. We are going to wait just a minute for attendees to join us. But in the meantime, I'm going to give you some facts about today's registrants. We have 285 folks from 42 states in the District of Columbia and from 5 countries other than the United States. So good morning and good evening to our international friends. 2/3 of our registrants have experienced a mass violence incident in their community, and over 1/3 have professionally responded to a mass violence incident. And for those responders, we hope that our National Town Hall series has been helpful to you in your professional development. And Claudia, are we ready to roll, or should we wait a minute?
It's totally up to you. We have 87 attendees at this time.
And it is, I'm going to give it one more minute. All right, Alyssa, we'll go to the next slide, please. As always, we are so grateful to the U.S. Department of Justice Office for Victims of Crime for its tremendous support of our center since 2017, and certainly of our National Town Hall series. As we begin today, we would like to take a moment of silence to recognize the community of Winder, Georgia, and Appalachia High School, and the 4 people who were murdered, the 9 people who were physically injured, and hundreds who were witnesses to yesterday's horrific mass shooting. We also recognize that yet another mass shooting is a difficult trauma cue for many of people. So we ask you to join us in a moment of silence. Thank you all so much, and welcome to our report out from the first National Mass Summit on Mass Violence Victims and Survivors, which was co-sponsored by our center and the National Center for Victims of Crime with support from OVC. Today, we'll highlight some key takeaways from our center's Partner Leadership Council that provides our field with an important roadmap for our collective future. We'll go to the next slide, please. Always the ever popular housekeeping announcements. This is being recorded and we have live ASL interpretation. Thank you so much to our interpreters. Closed captioning is available to you, so please go to your setting at the bottom of your screen and turn on closed captions, which is available in multiple languages. After being posted to the website, you're going to have the recording, the slide deck, and a pretty awesome resource page available for download at our website. And if you're joining us by telephone, please email us with your name and email address so that you can get credit for attending. And we, as always, want to thank so many of you who sent great questions to our presenters in advance. And we are going to save time at the end to answer the most frequently asked questions. So we have 4 important learning objectives for today. We're going to identify gaps in programs and services for victims, survivors, first responders, and communities that are impacted by mass violence incidents that were identified by our Partner Leadership Council. That also can be filled by partnerships at the national, federal, tribal, state, and local levels. We're going to identify some important takeaways to improve victim, survivor, and community access to collaborative, quality behavioral and mental health services and other types of supports and programs. And then you're going to learn a lot about the resources available from the 19 organizations represented on our Partner Leadership Council, and also a little bit about some of the latest resources from our National Mass Violence Center. So we have some great presenters today. I am Ann Seymour. I'm your moderator. I will be popping in a little bit later as a presenter. We have Eugenia Pedley, who is our Senior Program Manager from OVC, Dr. Dean Kilpatrick, who is the Director of our center, Dr. Alyssa Reingold, who is the Director of our Response, Recovery, and Resilience Division, Dr. Angie Moreland, our Associate Director of the National Mass Violence Center, who also directs the Improving Community Preparedness Division at our center, and Carrie Gonzalez, who's the Senior Emergency Management Specialist at the Virginia Department of Emergency Management, but she also represents one of our partners, which is the International Association of Emergency Managers. And we are so grateful to Corey and to Josh, who are our ASL English interpreters for today. Thank you so very much. So to get things going, we have welcoming remarks from Eugenia Pedley. Eugenia.
Thank you, Anne, and welcome everyone. Before I go any further, I want to add my condolences for those who are affected by that mass shooting that struck Georgia yesterday. All violence is hurtful, but violence involving children is really particularly difficult. All right, so as you know, this past July, our National Mass Violence Center held a summit in Pittsburgh. Dean and others will talk more about it, but I can say that from my perspective, it covered a lot of vital topics, and it was very successful. For a portion of the summit, the center gathered their partner leadership council members to talk through questions and ideas related to mass violence. Stakeholders were asked to come prepared to discuss a lot of things, including challenges affecting mass violence victims and ways to improve services for survivors. I think they focused on 5 themes that our presenters will go through in this webinar. And I think you'll find the discussion today to be both important and informative. So I'm happy you can join us today, and now I'll hand it back to Anne to get us started.
Thank you so much, Eugenia, and thanks also for talking about the challenges that were brought up at the summit, which were many. But I think the thing that was most heartwarming to me is that our partners came up with some amazing solutions that we're going to be so happy to share with you all today. So to get us going, we have our fearless leader, Dr. Dean Kilpatrick, who's going to give you an overview of the summit and of our Partner Leadership Council. Dean Kilpatrick.
The first thing I'm going to do is unmute myself and then start over. What I want to do is to give you kind of an overview of the summit in general, and then some of the goals of the summit, and then go through some specific information about the partnership meeting that happened as a part of the summit. So there were really 3 parts to the summit. The first one was an in-person summit that had 114 attendees that was held in Pittsburgh on July 17th and 18th of 2024. The second part was a virtual summit that had over 1,100 attendees that was held on July 17th. And this included the live stream content of the July 17th morning session of the in-person summit and a recorded afternoon session that addressed some fundamentals of mass violence preparation, response, recovery, and resilience. And then the final part that we'll talk most about is the Partner Leadership Council meeting that was held during the in-person summit. The goals of the summit are listed, and I am not going to read them to you because you can read them yourself, so I'll give you just a minute to do that. All right, next. The council itself contained 19 member organizations, and the purpose of the Partner Leadership Council is to provide expertise to the Mass Violence Center and create resources to help communities collaboratively and effectively prepare for and respond to mass violence incidents. There are the following goals are those of the council. And one is to hold regular meetings with our staff to identify and address gaps in services in preparedness, response, and recovery resilience. Secondly, to develop helpful resources that are relevant to specific populations affected by MVIs and that are survivor focused. The latter part is very, very important. And the third is really to collaborate with both our center and OVC to create a national landscape for all aspects of mass violence related programs and services, and one that can be replicated at the state, tribal, and local levels. I am not going to read all of these, but we thought it was a really cool slide to have the logos of all of the partner organizations. And I believe if you just give it a cursory look, you will see that it really kind of is a who's who of organizations that potentially have some role in preparing for and addressing mass violence as an issue. So you could kind of see why we would want representatives of these groups at the table to discuss and come up with ideas that they can then pass on to their members, which really magnifies the effect of what we can do nationally. So the summit had homework for the partner organizations, and we're very grateful to our partner organizations for the homework that they did, because that enabled us to really benefit from the time that we had in person at the summit. So the homework consisted of three things. We asked them to identify gaps in and challenges to providing survivor-centered mass violence incident preparation, response, and recovery resilience. Secondly, we asked them to identify priorities to improve our nation's capacity to prepare for mass violence and provide survivors with the quality services that they need. And then the third thing is that we ask them to provide information about, with URL links to, each partner's MVI related resources. And the resource guide includes all of the resources that they provided along with URLs to most of them. So once we had all this homework, we did content analysis of information that was provided, which yielded 5 important themes. The themes are, first, mass violence planning and preparation is critical. Second, inclusion of behavioral mental health resources in preparation and response is very important. The third is consideration of resources for impacted communities that identify community needs and seek to build trust is essential. The fourth is that creation of MVI victim survivor resources is definitely needed. And the final theme was that development of planning, preparation, response, and recovery resilience initiatives that address secondary trauma and vicarious trauma is also essential. So how did the magic work? At the meeting itself, representatives from the Leadership Council organizations met in 2 sessions lasting over 3 hours at the summit to process and discuss the information in the 5 themes. Discussion was conducted in 4 small groups facilitated by members of our staff. The groups identified key takeaways within each of the 5 theme areas, which were then shared with and discussed by the entire Leadership Council. Based on this process, key takeaways were refined and compiled into a preliminary report.
Thank you, Dean, so much for that. And I just want to comment that the first national summit in itself was historic, but to me, and I think to all of our partners, what was also historic was getting everyone into one room together for FaceTime for the first time. And the other comment I have is that when you look at the slide with the 19 partners plus us, it really does represent who needs to be involved in your mass violence preparedness, response, and recovery work. So we hope we're modeling good behavior just by having great partners at our table. So Dean mentioned 5 themes, and Carrie Gonzalez from the Virginia Department of Emergency Management is going to go through the first theme, which is mass violence planning and preparation. Carrie?
Thank you so much, Anne. It's an honor to be here today discussing this incredible initiative and our partnership. So as Anne mentioned, I'm Carrie Gonzalez. I'm an emergency manager, and I'm a liaison to the National Mass Violence Center from the International Association of Emergency Managers, or IAEM. We're one of those 19 partner organizations that have been previously mentioned. And these partnerships are so critical to effectively responding to and supporting victims and survivors of mass violence incidents. I hope that message is a key takeaway from today's town hall. The importance of establishing and fostering relationships with a common goal of providing evidence-based trauma-informed services to those impacted by mass violence cannot be understated. So as an emergency manager, planning and preparation is an integral part of our mission. In this field of work, we generally define preparedness as actions taken to plan, organize, equip, train, exercise, and exercising to build and sustain necessary capabilities to respond to and recover from disasters. But before we talk specifics about mass violence incident planning and preparation, I really want to call out that emergency managers have a really interesting role in these types of incidents. We are not experts in all of the things. Rather, our expertise is really founded on coordination and collaboration skills. Bringing the right people and right expertise together at the right time, that's part of our mission. And so it's our job to help build the network of people and organizations with that subject matter expertise, information, and other resources that will be essential to responding to emergency incidents such as mass violence. But it's important, mass violence has unique characteristics that also requires us to respond with an awareness and a sensitivity to the complexity of the impacts on everyone, on the victims, survivors, responders in the community. So it really requires a survivor-centered approach. And therefore, it's even more imperative that we engage with a broad variety of disciplines and stakeholders that brings the requisite knowledge and skills to provide that kind of support in the aftermath of an MVI. And so as we move through the presentations today, I challenge you, no matter what discipline or role you represent, to think about your network and look for new or additional opportunities to connect with other resources in your community and identify actions you can take to further planning and preparation for mass violence incidents. And so when we talk about preparedness in relation to mass violence incidents, what we're really looking to develop and maintain is a collaborative culture of preparedness, one that includes plan development, practice, which is typically called training and exercises, effective communication, and more practice that will help us clearly identify roles and responsibilities and capabilities that exist at that local, state, tribal, and federal level. The best way to do this is really to engage with all of the key partners proactively. And so on our key partners slide here, you can see that there's quite a bit of information on this slide. I am not going to read each one, but I do definitely want to call attention to a few key things. And so you can see that we have everyone from the governor's office, including emergency management, homeland security, criminal justice, education, social services, public safety and emergency management, law enforcement and firefighters, criminal justice system, our victim survivor assistance services, community-based organizations. Those are non-government entities, and also our healthcare and hospital partners as well. And so one of the things on this slide that I do want to call out is that I think it's important to note that local and state elected and appointed officials are a critical partner in our preparedness efforts through advocacy, legislation, funding, and leadership priorities, just to name a few. So they're a critical partner in our planning process as well. And so on the slide with our federal resources, you can see that our federal agencies and national associations provide resources before, during, and after an incident as well. And understanding the authorities, requirements, and response procedures of local, state, tribal, federal, and non-government organizations before something happens will assist with an organized integration into the overall community response to a mass violence incident. And so this list is not exclusive. You may be aware of other resources that can and definitely should be identified as key partners in your efforts. But most importantly, what these slides convey to me is that mass violence incidents require a multidisciplined approach. There's no one organization or entity that bears the sole responsibility in preparedness, response, or recovery. And so the key from this is being intentional, inclusive, and collaborative. It's important to sustaining that preparedness process. And so during the Partner Leadership Council, while we discussed many things, there were several key takeaways that became evident related to planning and preparation. First, resources. There are so many resources available to aid in preparedness efforts, but finding and understanding them can be a little bit like a scavenger hunt. So developing a resource collection of those existing resources will be valuable to many. Second, identifying credible messengers and validators. The resources and information won't be well received unless they're delivered by credible messengers and validators, those that are known to and trusted by the community that are being served. And third, creating a library and developing tools such as sample plans and memoranda of understandings, or MOUs, that can assist those responsible for developing these types of things. Starting from scratch can certainly be a daunting task and therefore may prevent people from actually doing so. So having tools and vetted resources available will provide a strong foundation to start from. And fourth, developing information and action plans for each of the NMVC partners so that these partners can amplify the message and provide a call to action to our stakeholders, and also engage in ongoing dialogue in a variety of ways. Next slide, please. So how do we turn those key takeaways into action? Some of the recommended tasks and deliverables that were identified include developing a national clearinghouse of resources, providing a centralized location of vetted information to help take the guesswork out of the validity of the information that's being provided. Working across the partner organizations and in communities to pre-identify credible messengers, but even more importantly, engaging them in preparedness activities to help inform the process of supporting victims and survivors. Developing a multidisciplinary toolbox, including training and technical assistance, sample MOUs and plans, again, providing that educational opportunity, template documents, and other items that help facilitate the planning processes. One of the most frequently recognized gaps is training and exercises. So how do we test what we say that we're going to do? And while there are some resources that are abundant, each discipline may have required training or other requirements, but very often we don't actually cross-train. We don't train and exercise together across disciplines. And so it's vital, this cross-training is vital to understanding roles and responsibilities, capabilities, and gaps. And this sort of exercise really provides a unique way to develop interpersonal and organizational relationships, which is a key to providing cohesive support after a mass violence incident. And also standardizing terminology related to mass violence assistance. Each discipline, each partner, each community utilizes different terminology, which can potentially create confusion or misunderstanding. So working towards common language in the mass violence environment so everyone feels comfortable and understands the language or the words that are being used. And so on the tools and the resources that should be developed include developing those sample MOUs, really providing and gathering all of those resources in one place. But more importantly than collecting them and developing them is socializing and sharing those plans. It's important that others become aware of those resources that are available and understand what they mean and what they mean to them. And while we're doing all of these things, one of the key takeaways is that we have to remember to not silo our efforts. Identifying roles for and engaging allies who address adjacent issues such as gun violence or school violence will only enhance our conversation. And then lastly, using after action reports to guide improvements. While it's unfortunate that individuals and communities experience mass violence, we must sensitively recognize the tragedy, learn from those experiences, and then be committed to continuous improvement in all aspects of mass violence prevention, mitigation, preparedness, response, and recovery. So collectively, we do have a lot of work to do, but I'm confident with the commitment from all of our partners and the support of this entire community, including those of you participating today, we can continue our efforts to support mass violence victims and survivors. Thank you, Anne.
Carrie, thank you so much. And thank you for emphasizing that emergency managers need to coordinate and collaborate with a broad variety of allies. And what I took away from the PLC was that victim service professionals and behavioral mental health professionals are really important allies. And we need to really be able to emphasize that. And the other thing, y'all are going to hear today, MOUs. People really need to, they really wanted to standardize the partnerships in writing so that people know what they're doing. They also wanted to standardize terminology. And Carrie, I appreciate you addressing that because there are challenges because everyone speaks different language from their perspective of their profession. And we need to come together with a unified language. With our center has been working on that project over the past year. So it's something we've already begun. So thank you so much, Carrie. And we're ready for our second theme. That is the inclusion of behavioral mental health resources in preparation and response. And that is Dr. Alyssa Reingold.
Thank you very much, Anne, and welcome everybody today. And as Anne mentioned earlier, I direct the Response, Recovery, and Resilience Division for the National Mass Violence Center, and have been doing so for the past number of years to be able to consult with communities that have been impacted by mass violence, both early on and then in just the long-term recovery efforts, because we know when a community's been impacted by mass violence, that journey can be many, many years. So here today to talk very briefly about the theme of inclusion of behavioral mental health resources, both in preparedness and in response, as well as recovery phases of mass violence. So one of the big, big themes in this area is the importance of including mental behavioral health resources in preparedness and response. So having a seat at the table early on in preparedness stages, as Carrie sort of mentioned, right? Being at the table with emergency planners and those in the communities to kind of help shape kind of what we might need to do and inform from trauma experts in the mental behavioral health field of sort of what's best practice, what's trauma informed, and how we think about supporting the community in the early response phase and then in the long-term recovery. We also want to make sure, however, that those resources, when we're thinking about preparedness and response, that they are culturally and linguistically appropriate for each community, and that that's included in the planning phases. Knowing your communities and who they are and what languages they speak to ensure that that's inclusive in that planning stage, so that way they can be there ready for response. Making sure those mental behavioral health resources are evidence-based. There's a lot out there in the mental behavioral health space, some things that are wonderful, some things that maybe just there, maybe people maybe like, but maybe it don't necessarily help in the long term, and some things that may actually potentially be harmful. And so we really do want to look at what we know works to help people during that response and recovery phases. We want to make sure that mental behavioral health resources that are included really addresses not only trauma, but also addresses grief in the aftermath of mass violence, both considering short-term needs and long-term impacts. We know that shifts and changes over time for mass violence victims, survivors, as well as first responders. So there are several key takeaways in this space of inclusion of mental behavioral health resources. One of the first takeaways is providing access to free training and technical assistance on evidence-informed early intervention resources in the aftermath of mass violence. There are several that exist out there. For instance, psychological first aid and skills for psychological recovery are two examples of evidence-informed early interventions that were developed by the National Child Traumatic Stress Network and the National Center for PTSD through some funding through SAMHSA. Both the National Child Traumatic Stress Network, who's one of our partners, and the National Center for PTSD do have free online training courses on PFA and SPR. And can provide some technical assistance. However, I think it's really important that we need to be thoughtful about how we can provide these types of trainings and technical assistance that's free to all communities, both preparedness and then shortly thereafter to help communities in the aftermath of mass violence. And trainings that's specific to mass violence as well as serving victims of crime, because victims of crime populations can be a little different and unique than, say, other types of large-scale traumas like disaster. And one of the other key takeaways is to develop or just assess what exists right now in the space of mental behavioral health programs and curricula that are for victims and survivors and first responders and their families to help educate people about the impact of trauma and about what that recovery process looks like. Not everybody needs necessarily mental health counseling after mass violence incidents, but it could be really useful for the community and victims and survivors and first responders to be educated on what trauma can look like for them, what they can potentially expect over the course of their recovery journey, and to have some sort of standardized curricula that exist out there. So each community, each resiliency center doesn't have to keep reinventing the wheel and creating resources for communities. So this idea of creating sort of a bank of already established educational materials that could be tailored for communities and the needs of specific communities, and then also developing sort of a train the trainer program in conjunction with resiliency centers that exist to be able to disseminate nationally to communities. For folks' reference, in the aftermath of mass violence, often a resiliency center is established to assist that community with a one-stop shop sort of hub for victims and survivors and family members and first responders to receive support in the aftermath of mass violence. And over the past decade, there have been over 24 resiliency centers that have been established across the nation. So we're learning now about some best practices in this space. And one of these areas is to kind of help create some sort of core curricula for individuals. So thinking about those key takeaways, there was some additional sort of discussion that kind of fleshes some of that out as well. As I mentioned before, helping identify and train and push out early intervention early interventions in the aftermath of trauma is really important. Now, as we look at early intervention and as we look at treatments, we really do want to recognize that not all interventions are the same, and we want to pay closer attention to the potential detrimental impact that some services might have if they don't lack evidence base. As I mentioned before, sometimes those interventions may be well received or satisfied, but they might not actually say help somebody treat their post-traumatic stress disorder, for instance. And so that person, although they may enjoy going to that type of service, might not actually, their PTSD might not actually be getting better, perhaps. So really paying attention to what exists out there across the spectrum of interventions. And identify evidence-based services and supports and help make those accessible. Document them so that they are easy to understand and what they are and what exists out there. So for instance, when it comes specifically to post-traumatic stress disorder, the National Center for PTSD does have some information about understanding what some of those resources could look like, but creating a hub or tool for mass violence specifically. And then also to increase our resource pool of trauma and crisis intervention trained professionals. They don't all have to be mental health professionals because not everybody needs mental health therapy in the immediate aftermath, but to be able to train folks on crisis response, on evidence-informed response in communities to be able to help in that response phase.
Thank you, Alyssa. And thank you also for highlighting the fact that impacted communities are very diverse and there is not a cookie cutter approach. There are so many factors that affect how we help a community, whether it's hate motivated, whether it happened as yesterday in a school. We really have to tailor the services to the community. And then the other thing, y'all are starting to see a common theme among our small group discussions. People want us to really document and disseminate what works so that they don't need to reinvent the wheel. And if I was going to say one of the major goals of our center, it's to do exactly that. So I appreciate you highlighting such important takeaways from the discussion in Pittsburgh, which leads us to our third general theme, which is consideration of resources for impacted communities that identify community needs, but also seek to build trust. And Dr. Angie Moreland is going to lead us in this discussion. Angie?
Wonderful. Thank you, Anne. So just you gave me the perfect lead into this and just really talking about how we need to tailor what we're providing and tailor how we're providing those services to communities. The resources fall right along with that. So what we've learned is that it's very, very important to consider resources for impacted communities that identify those community needs. So we know there are a lot of resources out there. We've developed some, and all of our partners have developed phenomenal resources, along with many others in the field around mass violence. But often those resources, there are many and they can be very overwhelming. So figuring out how communities can take those resources and figure out what's needed for their community and how they can apply the correct ones at the correct time is often a very difficult piece. So that's where these ongoing community needs assessments come in, which we'll talk about. And just as importantly, if not more importantly, trust is enormous in this area. So we really want to make sure we're using cultural brokers and credible messengers, making sure that we're taking the community, meeting the community where they are and with the people that they trust, and not just sending resources or coming in as someone who knows all about a community right after a mass violence incident, especially when it's the people that maybe weren't a part of that community to begin with. So figuring out what they were before and how we can meet them there. And then building these relationships and continuing these relationships that are needed to contribute to the long-term community resiliency. So along the lines of those resources, a couple of key takeaways that came out in the homework and came out really prior to the actual summit meeting in Pittsburgh that really drove our conversations while we were there. So first, developing a roadmap, or the need for developing a roadmap or process and a community engagement plan to increase cultural competence and practice cultural humility and across those phases. So across preparedness, response, recovery, and resiliency to ensure that they're all inclusive. So as I said just now, there's a lot of resources out there. If I were to ask each of you to do a little assignment right now and just Google what resources you could find, you probably could find a lot. But we don't really know if those resources are all inclusive, and if they encompass that cultural humility that's often necessary or always necessary as we're working with communities across that entire, all of those phases. Also standardize a training roadmap that can be adapted to diverse communities and traditionally marginalized jurisdictions and their unique needs. So when it comes to trainings, there are trainings that are available and trainings that are out there, but communities and partners are really saying, we need a roadmap. We can't take a list of trainings and just say, do this, do this, do this, and know who those trainings would be most relevant for, how we can use these trainings as a resource for us, and how we can really meet the community needs with these trainings. So it's not just taking a slew of trainings and throwing them at the community. It's really figuring out how we can follow a roadmap to make sure that we are being inclusive and that we are adapting these trainings to the needs of the specific communities. The third takeaway is developing a resource collection. So online library is probably one of my favorite phrases, and a thing that came up repeatedly throughout the summit. So we kept talking about library, and I don't even know if that's the right term to use, but basically coming up with something where people can have a menu or a library or just a collection of resources that they can go to and really understand across those different phases what services are needed, what services and resources are available, and across different levels. So for state, regional, federal, tribal, national, and just how we can take those resources and apply them when needed at the right time and in the right setting. And also, where do the funding streams lay over that? So what is available at the local level that may be available to support community efforts? And this really comes forth initially in the preparedness phases. So understanding what funding streams are available so that if and when they're needed, we can really engage in those funding streams and be able to have that knowledge and have that background to know what resources are available. And then document. So as Alyssa just said, it's so important to document what is working. So taking what's successful in these planning and response initiatives, figure out how they're working and in what ways they're working for different communities, paying attention to the mass violence site and location, the culture, the community demographics, kind of the landscape of the community that was there prior to the incident, and also whether it's hate or identity motivated, and figuring out how the specific resources can be and will be relevant for those different areas and at what time. And really taking that training and technical assistance and community engagement and involvement and figuring out how we can lay those resources on so that we can utilize all the different assistance and all the different involvements that we may have in the community. So this brought forth several discussions during our summit, and really had a very flavorful discussion of how we do these things. So those 4 things are pretty big takeaways. So those are large areas to really start talking about. So a couple of discussion points that really came out. One is to identify neutral conveners. So really starting with immediate post MVI spokesperson. So figuring out who can be these neutral conveners, how can we identify them early on, and having those people and those spokespersons kind of throughout the entire process of response and recovery, and having them kind of be that those go-to people in those relationships. And then really leveraging relationships that existed pre-MVI. So this is anyone who's heard me in meetings or heard me at other talks, this is probably the biggest soapbox that I often get on, is just that importance of leveraging those relationships. So the relationships and the trust that you have prior to the mass violence event really play directly into the resources and what can be available following that event and in all of those months and years to follow. Identifying and convening partners. So really not only having those relationships at the local level, also at the national level, and figuring out how those partnerships can be utilized and how we can move forward and really leverage those to be able to consider what resources are needed and how we can push them out in those communities. Developing and implementing MOUs among partners. So it's never too early to start doing this. The last thing that you want to be doing is in the wake of a mass violence incident, figuring out paperwork and MOUs and how to create necessary partnerships to be able to deliver the resources and deliver the services that are needed. So developing those and implementing them very early on so that you can then build upon those and utilize those MOUs moving forward. And then very, very importantly, identifying what's already existing and what's not existing, developing needs assessment instruments to use. So we talk about this very often, and it was the key discussion among many people at the summit of how can we take something and develop it or adapt it that is at the hands of communities when they need it, and they can utilize that needs assessment to figure out where the community is, what resources are needed, and at what times. And And this really will help to identify resource needs for many different types of communities, but specifically for rural and other traditionally underserved jurisdictions. So in areas that we don't necessarily know what the needs are, or that the needs are even greater than in some other areas, how can we take these instruments and really utilize them to figure out where our resources can be used and have the biggest impact? And then a few more to develop and provide culturally and linguistically appropriate training for relevant populations. So, building on what my colleagues said right before this, of just what's so important is we have many of the resources, we have many of the trainings, but how can we take these trainings and really figure out without making a different training for every single type of person, but make it so that they are culturally appropriate and linguistically appropriate so that they can be applied to the different populations and then they can be relevant. The worst thing possible to do is to provide a training or to give a list of resources to a community that is not going to use it because it doesn't apply to their population and their community. Ensuring that all activities that we conduct are culturally appropriate to that community and to that MVI. And that really takes that preparedness ahead of time. So knowing your community and knowing what may work, and then knowing that you also may have to shift and change that a little bit every single day or at every single phase as you move forward, because you constantly learn new information. Establishing in advance a fiscal entity or foundation to receive funding and donations. So funding and donations is often a key discussion when we talk about resources. What can we do to receive these funding and donations? We oftentimes, many of these are starting to come in, and how can we manage them and really establish that in advance so that we're not trying to figure it out right after a mass violence incident and figure out how we can receive all this money that's coming in and use it appropriately. And then lastly, contact the NMVC to create an MVI specific webpage within the Virtual Resiliency Center. So those of you who have not heard of the Virtual Resiliency Center or don't know much information about that, we'd be happy to share. But it really is important and I think very unique to be able to have a mass violence specific webpage within that resiliency center that's culturally and content appropriate to the impacted community so that that can be utilized as needed following an event. So thank you so much for your time. I'll turn it over and hear our next speaker.
Thank you, Angie. And I just want to reflect that in 2023, last year, when the RFP came out for the National Mass Violence Center, OVC focused in language on traditionally marginalized communities and underserved victims and survivors. And so I'm so glad this small group focused like a laser beam on that. And this could be folks in highly urban communities, tribal, rural, remote communities. We have resiliency centers that reflect most of those definitions of underserved communities. And as you know, we are working hard on doing standardized individual needs assessments, both to be used at the initial family and friends center, but also longer term by resiliency centers. And so I'm really happy that some of the suggestions that people had, the good key takeaways, are things that we're already working on. So now I get to turn it over to me. I'm going to wear the hat of a presenter for a few minutes because I had the good fortune to facilitate the small group in Pittsburgh that looked at creating mass violence victim and survivor resources. My group had a survivor, a couple of victim service professionals, and a rock star crime victim compensation director representing our partner, the National Association of Crime Victim Compensation Boards. So we were able to really come up with some really good takeaways and some good discussion that I'll share with you today. So basically, we want to create victim resources that Alyssa, I think, emphasized a lot, that are based on research, that are based on lessons learned. But the most important takeaway was that we really need to find a way to engage victims and survivors across the planning, response, recovery, resilience continuum. And there was just a real focus in this group about victim compensation and a recognition of the importance that comp plays in victims' lives following a mass violence incident. So all of the small groups were assigned to try to end up with 2 key takeaways. Being victim service providers, we ignored it and came up with 4. So they're all good, they're all important, and we could not successfully moosh them together. So please bear with me. As I just mentioned in the broader theme, engaging victims in a meaningful way, not just as token representatives, but recognizing what they bring to the table because of their lived experiences with mass violence. The other, I told you, document and disseminate is the theme of all of our small groups, but they really suggested that we focus on financial assistance resources, including and emphasizing crime victim compensation. But they also thought it would be good to have policies and procedures. When you commit to something on paper, it's a little bit different than when you just say you're going to do it, to be able to guide financial assistance initiatives. And, this does include compensation, but it's things like also the National Compassion Fund, which is run by our partner, the National Center for Victims of Crime, and for other funds that pop up at the local level to provide direct financial assistance to victims, to survivors, and to first responders. So make sure that we're pushing that information out quickly and frequently. We want MOUs. We want to be bonded and glued to the hip of emergency planners and other community partners. And we sort of broadened our scope to be not just victim service professionals, but also our allies, which are the behavior and mental health professionals that we feel we are just critical to every aspect of the full landscape of mass violence, and that people should not attempt to do this work without engaging victim service professionals and behavioral mental health folks. And then I'm not going to talk a lot about secondary trauma because we had an entire small group that focused on that. But we talked about, and it was very personal conversations about how this work affects us. And I know everyone sitting at their computer screen now is nodding and bobbing. If you have responded to a mass violence incident, it's a life-changing event. And some people who respond continually, it's something that almost always you end up with a little bit of lingering trauma, sometimes with longer term secondary trauma. So those are our key takeaways. And I'm going to talk a little bit about our discussion. We want a framework. We want something that is clear and easy to understand, that makes sure victims and survivors are at the table, and to treat them as the professionals that they are, and to really recognize and validate not only their lived experiences, but also they are subject matter experts in their own recovery process. But I don't know a mass violence victim survivor who works with us who hasn't also done the work to learn about evidence-based practices, to learn about what works so they can help others. They always say, I do this work because I don't want it. I don't want my experience to happen to anyone else, which I think is very, very important to recognize that. So we need to legitimize their value. We also need to make sure that survivors are connected to what Alyssa mentioned earlier, the long-term resiliency centers. I think we now in our resiliency center network have 24 or 25 that provide the longer term support for victims and survivors, making sure they know that in the immediate aftermath, when everyone's there at the Family and Friends Center and then the Family Assistance Center, that longer term, there's often going to be support from the Resiliency Center. And then, as Angie just mentioned, we now have our brand new virtual Resiliency Center, which can also provide support and comfort to mass violence survivors. And then I think something that's really, really important is to recognize that there's often limitations or challenges to victims even accessing services due to immigration status. There could be stigmas related to seeking mental health support, all kinds of barriers. And I said recently at the VOCA Center conference that if you build it, they may not come. Just because we have bricks and mortar services, we shouldn't expect people to just show up. We need to meet people where they are. We need to recognize it can be very difficult to take that step to access and ask for services. So that was one of the most important discussion points from our group. We focus a lot on victim compensation, and I learned so much from this discussion. We think all comp agencies should have Go kits that include necessary victim survivor information and forms and applications. And if you go to our website, we actually have 2 tip sheets on Go kits, one for victim service agencies and one specifically for victim advocate responders. So I encourage you to look at those Go kits because really helpful information to know if you're going to show up to the Family and Friends Center. Everyone wants an abbreviated sample mass violence specific comp application that should be developed and shared with all state comp agencies. We're really lucky that the National Association of Crime Victim Comp Boards is one of our partners. We're also fortunate that a number of states, most recently Maine, have created abbreviated forms. And so I see this as a kind of low-hanging fruit that I'm excited about working on because it's something that we can document and disseminate, my favorite words today, to all victim compensation programs who are such important partners to all of us, regardless of what state we live in. And then the last thing is that sometimes there are special benefits from comp programs that are specific to mass violence victims. And it could be the fact that we're expediting their cases. And there are other things that may be just for mass violence victims. We want to find out what those are and be able to document them so that crime victim comp programs know that this is information they should be sharing with their victim clients. And then the final things we talked about is that we've been through enough mass violence incidents that predict is a weird word, but we sort of know based on our previous experiences which services could be overwhelmed. In our experience, it's very often victim services. It's very often behavioral mental health counseling. And so thinking in advance, going back to what Carrie was talking about, the plan and preparation, kind of expect that and be able to build up your contacts so that you are able to provide those services. And I know in a number of mass violence incidents, victim services and mental health folks from other states and other regions within a state have all come into the community that's impacted to augment the services. And so thinking ahead about what those services might be is really, really super important. The next one, I have to be honest, it would be really helpful for me personally, and that is document, disseminate who does what. And it's not just who does what, but how different agencies and entities end up responding to a mass violence incident based on the type of incident it is, based on an invitation from local law enforcement agencies. But people want, and I can visualize it, I love infographics, a beautiful infographic that says who's there and who does what and how are they activated. And I say this is easy. It's not easy, but it's really, really important. My best takeaway from the entire summit, including the PLC, was to document and understand the demographics of the community: age, gender, race, culture, languages spoken at home, all of those demographics. And you don't have to wait till a mass violence incident occurs. You can actually do that work now. And what I learned in our Partner Leadership Council is the mayors know that information. The County Board of Supervisors know that information. The university administrators know that information. If you're in Indian country, the tribal leaders have that information. Why is that important? Because in advance, you need to be able to understand the demographics, going back to what Angie was saying, that so that we can tailor what we're doing to the community. We've talked a lot about MOUs, but we asked for MOUs specifically between emergency management and victim survivor services. We recently did a webinar with the VOCA Center and the National Mass Violence Center that addressed this issue, and we will let you all know when this becomes available. We want MOUs in writing. That's going to be really, really important. And I do just want to say, and I don't want to steal the thunder of our final general theme, but I think across all five general themes. Secondary trauma and vicarious trauma was a really big theme. And when people talked about it in Pittsburgh, it was personal. It wasn't high level up here. It was how they felt after responding. And it was telling experiences about hearing from their fellow victim service professionals and other first responders about the long-term impact of the work. And so that popped up into our small group discussion, but it ended up becoming, as a general theme, a whole nother small group discussion. So I am going to turn it over for our final general theme. And we're so lucky we get Alyssa twice today. She's going to talk about developing planning, preparation, response, and recovery resilience initiatives specific to secondary trauma and vicarious trauma. I cannot emphasize enough how important this is. Thank you, Alyssa.
Thank you. And thank you for having me. This actually, I'm going to be highlighting some key takeaways. I was not part of this group that was talking through some of these topics. I was in a different group, but I'll hopefully do well to kind of highlight some of the takeaways related to addressing secondary trauma and vicarious trauma. So mainly, really important to develop and ensure that planning, preparation, response, and recovery resiliency initiatives, that all of that addresses secondary trauma and vicarious trauma among all mass violence responders. So when I'm talking about responders, mass violence responders, I'm not only talking about law enforcement and firefighters and EMS, dispatch. I'm also talking about healthcare providers and victim service professionals, as Anne sort of mentioned before, but also, crime scene recovery, crime scene cleanup individuals, perhaps even emergency managers that were there on the scene, as well as local leaders. So just to name a few. So we just want to be more comprehensive when we're thinking about responders to mass violence and ensure that we've got plans in place and for addressing the secondary and vicarious trauma that they may be experiencing, to create resources, strategies to help people recognize these signs, have the skill sets to help mitigate the impact of secondary trauma, both for ourselves as a mental health professional and identify as victim service professional, but as well as helping our peers. We often, as helpers, most of our responders are helpers, we often don't necessarily always take care of ourselves. We usually focus on those that we serve, and we don't necessarily often recognize that we can be impacted. And so kind of helping develop additional tools and resources to help people understand this impact it can have. So thinking about some of the key takeaways from this area of secondary and vicarious trauma, one of the takeaways that came away with is to as a field, we need to think about how we can advocate for increased access for all responders. Both those that are still employed and perhaps ones that may have retired since their mass violence incident or left the field, perhaps because of that incident, ensuring that they have access to ongoing care, whether that's if they're employed through EAP or access to just ongoing mental behavioral health services or victim support services. So ensuring that folks have access in the long term. And then the second key takeaway was creating a multidisciplinary team or working group to really survey the field. There is a lot of good information out there in this space, and really survey and look at what exists out there, develop perhaps some standards for staff training around secondary trauma and vicarious trauma. And ensuring those trainings are evidence-based, or ensuring that the programs that we're training are evidence-based, that they address the needs of specific responders, what a healthcare professional needs may look a little bit different or might need to be adapted for that population versus a law enforcement officer. Each have their own culture within their profession. So making sure that those types of resources are adapted for those different professional cultures. Also making sure that we're as comprehensive, not only addressing the needs of our responders, but their families who are also indirectly impacted by the experience that their loved ones may have had, or maybe they were directly impacted if their loved ones were also physically injured or directly impacted by the incident. So ensuring that they are attended to. We also need to survey the field and develop standards and tailoring it for urban populations. So professionals working in an urban space is going to be looking a little different around what their secondary and vicarious trauma resources may need to be versus those residing in suburban areas or rural areas or even in tribal communities. So creating sort of a work group that really looks at the landscape of the field and looking at what are some best practices and how we can develop some of those standards around that. There are, like I said, some really good resources. So we don't need to create resources because there's some really good ones out there. For instance, stress first aid is one that is a useful resource. But really kind of looking at what are those resources and how can we tailor them for specific populations. So based on those two key takeaways, there's some additional discussion around kind of what this means and some fleshing that out a little bit. When we're thinking about developing resources, we're also thinking about developing sort of a long-term timetable that includes some communication and support strategies that entities and agencies can use, because what responders might need early on and what might need to be communicated and what type of support might need to be given early on to help with combating vicarious trauma is going to look different from what they may need 6 months out, which may look different from what they may need 2 years out. So creating sort of a timetable of what those type of resources can be, what communication strategies that leaders in those spaces can use, and help them understand kind of what type of support their group of responders may need. And again, ensuring that this not only addresses the needs of existing staff, but those who may have left the field, as well as their families. There's also some discussion on kind of the role that media plays and how media coverage has been in mass violence incidents and how responders have interacted with that in helping, ensuring that there's additional resources around preparing employees for that process. We as responders don't always get prepared for how to deal with media, but mass violence incidents usually get very wide scale coverage. And so helping responders understand how to work and navigate media in collaboration with perhaps their public information offices. Developing some markers for when secondary trauma and vicarious trauma reactions may occur. And again, there is some information already that exists from research on this. And so they're, leaning on some of that research and helping educate organizations and agencies about what to look for. Similarly, activate peer support programs. I know that in certain areas, there's some really great peer support models that exist, ensuring that those models have some trained leaders that can address the specific needs as it relates to mass violence incidents, and helping them build on encouraging the culture in organizations of employees and peers noticing your coworker status. How do we, our bystander interactions, how do we take care of each other, and activating some of those more regularly. We want to recognize sort of that the lack of resources and peer support that exists in rural and remote and tribal communities, and kind of being thoughtful in the preparedness side of how we can include that in your preparedness plans to address that issue in those communities so that they are fully supported. And then develop national training programs. There again, there's a lot of good information out there. There's, OVC has a vicarious trauma toolkit for agencies to help them integrate and be trauma informed and address vicarious trauma in organizations, but really kind of helping better understand and predict problems as it relates to mass violence, to be able to create some long-term solutions, and ensuring that that there's an outreach model developed, messaging communication plans are established, is really important. And then lastly, providing training and train the trainers programs on secondary and vicarious trauma that's easily accessible, right? That's hopefully free, that people can access these types of trainings to be able to bolster their own support within their own communities and their own agencies. So it can be already integrated in employee training programs that exist. And then the last thing here is really just to normalize the importance as helpers for self-care for ourselves, and work-life harmony. And as you can see, the word harmony here, not necessarily balance, because I'm not sure we will ever balance work and life. It's really a harmony, and how we coexist with the work that we do, and normalize the importance of taking care of ourselves.
Well, and Alyssa, that last takeaway is something that just goes so far beyond just the mass violence field. It's something I think we all need to really be cognizant of. And the other thing is looking at secondary trauma. It's another example of work that we've already committed to and we've already begun at the National Mass Violence Center. And so to get our partners to agree about the importance of emphasizing that was really validating to us. So finally, after we had folks together in a very intense discussion for 4 hours, one of our partners said our collective goal should be to do no harm. And I know we're plagiarizing the health profession with that, but there was a lot of nodding at that. And I think that's a takeaway kind of for the whole Partnership Leadership Council. And I really feel that if we do everything and we follow all the takeaways and develop the resources that people said are needed, that will contribute to our collective capacity to do no harm. So we're going to go on to one strategy or skill. It's always one of my favorite parts about our national town halls. Asking folks to just give one final takeaway that you want people to remember. And Angie, I'm going to start with you.
Okay. As you said, it's very difficult to narrow it down to just one, but I think to encompass the resources and the consideration of resources for impacted communities, I would say that it's essential to provide individuals, agencies, and communities with evidence-based resources and roadmaps. And this way we can ensure they can effectively address mass violence response and recovery in a culturally responsive manner.
Wow. Perfect. Thank you. Thank you, Angie, so much. Dean Kilpatrick, one skill or strategy.
Well, mine could be obvious from the basis of today's discussion, but it is that we are better together. Mass violence is too big a problem for any one person, agency, or organization to solve, but we can make great progress by working together to share information, find common ground, and forge collaborative solutions.
Yeah, Dean, thank you. Nobody can do this work alone. So we just always have to remind ourselves of that. So thank you so much. Alyssa.
So it was hard to come up with one key strategy, but I would say it is essential that behavioral and mental health resources in preparation and response are culturally and linguistically appropriate, that they're evidence-based, that they include the awareness of complex grief, as well as short and long-term impact of mass violence on victims, on survivors, as well as on first responders.
And the thing I love about Alyssa is she can move. Oh, sorry, I got muted. Alyssa, I just said your skill is to moosh 5 strategies into one. So thank you for that. Great strategy. Carrie?
Yeah, I think one of the important things to convey is that, preparedness is everyone's responsibility. engaging in all of those activities, the types of things that we've talked about today on the town hall with all of our partners is really essential to bring that holistic, trauma-informed, survivor-centric approach to victims and survivors of a mass violence incident. And so we have to work together ahead of time to make sure that we have the right people, skills, and capabilities in place. And because I didn't moosh very well, but I do want to say that I think along with that is that don't be afraid to take that first step in preparedness actions, right? Small actions can yield big results. So make that contact, make that first phone call, reach out to your partners, and engage in those activities.
Well, and Carrie, thank you. That is like a perfect segue to my best strategy that came years ago from one of my sheroes, Shirley Chisholm, who said, if they don't give you a seat at the table, bring a folding chair. And we, being victim service professionals, behavioral mental health professionals, we need to assert our value and our expertise and our experience to all those who are involved in mass violence preparation and response. Don't wait for the invitation, just show up. I think that's a real strong message from all of us. And if you want to request technical assistance, you can email us for consultations. If you want technical assistance that is specific to planning and preparation, that would be the ICP TTA, and we'll make sure that you all are going to receive the slide deck so you'll be able to follow on. Thank you. We got some great questions from the field, and I am hoping we have time to answer all of them. So the frequently asked questions that we did a little mooshing on our end are going to focus on some of the themes that we discussed today. And the first one, Alyssa, I'm going to give this to you. And that is, how can we help educate agencies about the initial response following mass violence incidents, and specifically about the language we use?
Yeah, I think that's a really good question, and a number of people had asked that. And I think one thing to be mindful is, historically in the field, they've used the term reunification center, family reunification center, to designate that initial place where people can go to perhaps get information or, to get some updates and resources. And we would kind of recommend not using that term reunification, because unfortunately in mass violence incidents, not everybody reunifies with their family. And so that especially can be difficult for those families. So we are encouraging people to not use that term reunification, and instead perhaps use other terms such as family and friend center, and as a way for folks to family and friends to come together and gather information. But that needs to be included in people's emergency response plans, right? That language matters. And so really looking at your preparedness plans and your emergency response plans at language, and seeing what it says there, because that's going to be what guides communities in that response effort. So kind of being mindful around that. Also educating media around some of that terminology can be really helpful. The National Mass Violence Center does have some helpful resources too around kind of preparedness, under Prepare Your Community and Rebuild Your Community on our website. And then we have some really good resources on 16 best practices when it comes to preparedness that also can guide a little bit more about that response phase and how to kind of create one that is trauma informed. And so there's some really good resources there. The FBI has also a really good protocol on establishing a family assistance center and kind of what kind of goes into that process, and how to do that in a trauma informed, victim centric way. So just some food for thought.
And Alyssa, thanks for emphasizing that language matters, because one of the deliverables people are asking for is common terminology. And so being able to get people away from the dreaded term reunification is something we're all very much committed to. So thank you so much for that. Our next question is pretty meaty. How can cities enhance victim supports by putting in place the right preparedness activities? And I know we've talked a little bit about this, But Angie, you always have a little bit more to add, so I'm going to throw that one to you.
Thank you. I would have a lot more to add if we had the time on preparedness, because I feel that there's a lot of work to be done. There's a lot of work that has been done, but continue to work to be done on how to enhance these victim supports. But just to narrow it down to a couple of very key pieces, which Carrie talked about and I talked about, and we all kind of talked about a little during our presentation, is really that importance of partnership and trust. So really looking at, if you're going to answer this question, look at one slide, the one that Carrie put up about the state and local partners. And the more collaboration and partnership and trust that you can build ahead of time in your community, even if it's not mass violence specific. Ideally, you want it to be mass violence specific, but any partnerships that you can have where the day or night of an incident, you walk in to conduct that response and you see someone and you already trust them, you know who they are, and you know what their role is, why they might be there, and what they could potentially do is enormous. So really looking at those state and local partners. And a lot of times within cities, we don't always know what partners are even available within our city and what they do. So learning those pieces as you prepare and knowing that you're only going to make the response that much stronger by building up those partnerships ahead of time. There is strong leadership typically from mayors, and we have a very close partnership with the U.S. Conference of Mayors. I would encourage everyone to look on our website. It's included in our resource guide, but then also on our website, we co-branded a document called a timeline for mayors' engagement of victim service professional in advance and in the aftermath of a mass violence incident. So this is a great document to really look at and how to build those partnerships with mayors and then across cities, or within cities, sorry, to be able to really start to prepare very early on and what you can be doing in those early phases before an incident would even occur.
Great. Thank you, Angie. And I just want to reflect briefly when we responded to the mass shooting at the Navy Yard here. I know when you all responded to the mass shooting at Mother Emanuel, we didn't have mass violence plans. What we had was great relationships with the people in the community who were necessary for the immediate response and the longer term recovery and resilience. And I just offer that because having those relationships in advance is just super, super important. So thank you, Angie, for that. And Dean, this is custom made for you. How do we distinguish reactions caused by recent events, traumatic events, or mass violence someone maybe experienced 3 years ago?
You're muted.
Sorry. The short answer is with great difficulty. But let me elaborate on that to make it a little clearer. First of all, most people have experienced multiple potentially traumatic events and other stressors throughout their lives, and these have a cumulative impact on the risk that you'll have mental health problems such as PTSD, depression, or substance use problems. What happens during a mass violence incident is obviously also a very important risk factor for such problems. So basically people if you've had a family member killed, if you yourself have been physically injured, if both of those things have happened, if you barely escaped with your life, that's going to be worse than if you were less seriously impacted by that. But the really important thing is that what happens before the mass violence incident and after the mass violence incident is also important. So if you look at a survivor and you see how they're doing today, that's going to depend on several things. One, it'll depend on whether traumatic things happened to them before the MVI. How bad the MVI was is going to make a difference. If they have good social support, they'll probably do better. How they were treated after the MVI makes a big difference as well. If they have received effective services after the MVI, that's going to matter. And then whether they've had some sort of traumatic or very stressful experience since the MVI happened is going to make a difference. So, for example, one example of that would be, the school shooting that happened yesterday. So if you had an MVI 3 years ago, having that school shooting happen yesterday is going to exacerbate, problems that they have now. So the important thing is we can't change what happened in the past. We can't change what happened during the MVI itself. But it is really, really important for us to treat survivors well after the MVI and make sure that they get the services they need. That will make today better than it was 3 years ago when the MVI happened.
Thank you, Dean. I feel like we need a whole PowerPoint presentation just on that question and answer. So I'm tucking that away. Carrie, I am going to give you this. It's a really good question. How do we integrate small rural municipalities like police and fire departments into our response efforts, those who don't have a bunch of services?
Yeah, I think it is important to recognize that resources are often much more limited in rural and remote and tribal communities. And so, but it doesn't mean that it's a futile effort, right? So engaging all of the resources that are available at the local level is key. But we do that by providing access to those free resources. We've heard about a lot, the development of a lot of tools and resources and training that's offered by an MVC and our other partners as well. And so closing that gap, providing that training and education opportunity with that free price tag on it is often key to engaging already overtaxed resources. The key is really not reinventing the wheel, bringing the partners to the table and utilizing trusted, vetted information and sources that already exist. And again, staying engaged in conversations like this with the town hall and other initiatives by our partners, such as the Mass Violence Advisory Initiative. It's a good way to help sort of integrate a variety of resources and bring in those state and national resources to communities that may not have the vast resources that are necessary for this type of response.
And Carrie, thank you for that and for the mention of the Mass Violence Advisory Initiative, which is a program of our long-term partner, the International Association of Chiefs of Police, who do a lot of work in rural and remote communities. So I appreciate your reference to that. I'm going to quickly answer a very meaty question. How do you get comp programs inserted into emergency plans and programs? My quick answer is we just had a virtual training program exactly on this topic, which was co-sponsored by our center and the Office for Victims of Crime VOCA Center, and it was excellent, and we will publicize it to you when it becomes available. As I said earlier, victim comp programs and all victim services, we need to make the case about the value we bring to readiness, response, recovery, and resilience to emergency planners, and we can never assume that emergency planners know what victim comp is. It's up to us to educate them so that we are invited to the preparedness planning table. And if we're not invited, remember to bring that folding chair. So that concludes our Q&A for today. Thank you to our presenters. My final message is we love your evaluation of our presentation. So after ending this year's session, a survey is going to appear. It'll just take you a couple minutes to fill out. What you all need to know is we actually really read the surveys and suggestions, especially y'all give us great suggestions on future topics, which we're looking for one for the next couple town halls. So please help us by completing the survey. I want to thank our Partner Leadership Council. I want to thank OVC, our partner for the summit, the National Center for Victims of Crime. And I certainly want to thank all of you who took time to attend today's session. We will be having a summary report that goes into greater detail about the takeaways from our Partner Leadership Council. Again, you will be notified when this becomes available. So thank you all so much for attending our 11th National Town Hall. Have a good day.